In various fields, from photography to microscopy, the application of cross-polarized light has revolutionized the way we visualize and understand our subjects. This technique, which involves using polarized light to selectively filter out unwanted reflections and glare, offers a unique perspective that unveils hidden details and enhances clarity. In dentistry, cross-polarized photography has emerged as a game-changer, providing dentists with a powerful tool for diagnosis, treatment planning, and patient education. Traditional dental photography often struggles with the challenge of capturing clear, detailed images of teeth and oral tissues. The highly reflective nature of enamel, combined with the presence of saliva and other fluids in the mouth, can result in images marred by glare and obscuring reflections. This glare not only affects the aesthetic quality of the photographs, but can also mask subtle details crucial for accurate diagnosis. For instance, detecting early signs of decay, hairline fractures, or subtle changes in tissue texture can be difficult under normal lighting conditions. Cross-polarized photography addresses this issue by utilizing two polarizing filters, one placed over the light source and the other over the camera lens. These filters are aligned perpendicular to each other, effectively blocking out light waves oscillating in a specific direction. This selective filtering significantly reduces glare and specular reflections, revealing the underlying textures and colors with remarkable clarity. The result is a set of images that are not only aesthetically superior, but also diagnostically richer. By eliminating the distracting glare, cross-polarized photography allows dentists to visualize the intricate details of teeth and oral tissues, leading to more accurate diagnoses, more effective treatment planning, and ultimately, better patient care. The magic of cross-polarized photography lies in the fascinating science of light polarization. Light, in its natural state, is a wave that vibrates in all directions. Polarizing filters act like selective gates, allowing only light waves vibrating in a specific direction to pass through while blocking others. When two polarizing filters are used in conjunction, with their polarization directions perpendicular to each other, they create a system where only light waves that have been twisted by the subject can pass through. In the context of dental photography, this twisting of light waves occurs when light interacts with the complex structures of teeth and oral tissues. Enamel, with its crystalline structure, and other oral tissues with their varying densities and compositions, affect the polarization state of light as it passes through them. By filtering out all other light, cross-polarized photography captures only the light that has interacted with these structures, revealing their unique optical properties and highlighting subtle variations that would otherwise be hidden. Imagine shining a flashlight on a smooth, polished surface. The light bounces off directly, creating a bright glare that obscures the surface details. Now, imagine shining the same flashlight through a polarized filter onto a textured surface. The light, now polarized, interacts differently with the texture, creating a pattern of light and shadow that reveals the surface details. This is essentially what happens in cross-polarized photography, except instead of a flashlight, we use a specialized light source, and instead of a textured surface, we have the intricate structures of teeth and oral tissues. This technique, therefore, provides a unique perspective into the micro-world of dentistry, allowing us to see beyond the glare and delve into the subtle nuances of dental structures. It's like looking at a tooth under a microscope, but instead of magnifying the physical size, we are magnifying the optical properties, revealing hidden details and enhancing our understanding of the subject. Setting up a cross-polarization studio for dental photography is a relatively straightforward process, involving a few key components: a light source, a camera, and of course, polarizing filters. The light source should be powerful enough to illuminate the oral cavity effectively, and it should be equipped with a polarizing filter that can be easily rotated. LED lights are a popular choice due to their high intensity, low heat emission, and long lifespan. The camera should be capable of capturing high-resolution images and should have a lens that can accommodate a polarizing filter. DSLR cameras are commonly used for their versatility and image quality. The heart of the system lies in the polarizing filters. These filters are typically circular polarizers, designed to be mounted on the camera lens and the light source. Circular polarizers are preferred over linear polarizers in photography, as they do not interfere with the camera's autofocus system. It's crucial to choose high-quality polarizing filters that effectively block unwanted reflections without introducing any color cast or distortion. Once the equipment is in place, the setup process is simple. The polarizing filter on the light source is rotated until it is perpendicular to the filter on the camera lens. This alignment ensures that only light waves that have been twisted by the dental structures can pass through, effectively eliminating glare and specular reflections. The camera settings, such as aperture, shutter speed, and ISO, are then adjusted to achieve optimal exposure and depth of field, ensuring sharp, well-lit images. While the setup may seem technical at first glance, it becomes intuitive with practice. The key is to understand the basic principles of polarization and how the filters interact with light. Once this understanding is established, setting up the cross-polarization studio becomes a seamless process, enabling dentists to unlock the full potential of this powerful imaging technique. The benefits of cross-polarized photography in dentistry are numerous and significant, impacting various aspects of dental practice. Firstly, the elimination of glare results in images that are significantly sharper and clearer, unveiling the intricate details of teeth and oral tissues with remarkable precision. This enhanced clarity not only elevates the aesthetic quality of the photographs, but also provides a wealth of information that might be missed under normal lighting conditions. Subtle variations in enamel texture, early signs of demineralization, hairline fractures, and other subtle details become readily apparent, facilitating more accurate diagnosis. Secondly, cross-polarized photography improves color accuracy, providing a more realistic representation of the true colors of teeth and oral tissues. Traditional dental photography often struggles with color accuracy due to the interference of reflections and glare. These reflections can distort the perceived color of the subject, leading to inaccuracies in diagnosis and treatment planning. By eliminating these reflections, cross-polarized photography allows for a more faithful representation of the true colors, enabling dentists to make more informed decisions based on accurate visual information. Finally, cross-polarized photography enhances the visualization of certain dental conditions. For instance, in the case of dental caries, cross-polarized light can penetrate the enamel surface, revealing the extent of demineralization and the presence of subsurface lesions that might not be visible under normal light. Similarly, in the case of cracked teeth, the technique can highlight the cracks with remarkable clarity, aiding in the diagnosis and treatment planning. These advantages translate into tangible benefits for both the dentist and the patient. For dentists, cross-polarized photography empowers them with a powerful diagnostic tool, enabling them to detect subtle dental issues, monitor the progression of existing conditions, and plan treatments with greater precision. For patients, it provides a clearer understanding of their oral health, facilitating informed decision-making and fostering greater trust in the dentist's recommendations. One of the most remarkable benefits of cross-polarized photography lies in its ability to enhance the detection of dental issues that might otherwise go unnoticed. Traditional dental photography, with its inherent limitations in dealing with glare and reflections, often struggles to capture the subtle details that can indicate underlying dental problems. Cross-polarized photography, on the other hand, excels in this domain, providing a level of clarity and detail that significantly improves the diagnostic process. For instance, early signs of dental caries, often characterized by subtle changes in enamel texture and color, can be difficult to detect with the naked eye or through conventional photography. The demineralization process that leads to caries alters the optical properties of the enamel, creating subtle variations that are readily highlighted by cross-polarized light. By capturing these variations, cross-polarized photography allows dentists to identify early carious lesions, enabling timely intervention and potentially preventing the need for more extensive treatment in the future. Similarly, hairline fractures, which are tiny cracks in the enamel that can be difficult to spot with traditional methods, become readily apparent under cross-polarized light. The light, as it interacts with the crack, undergoes a change in polarization, creating a distinct pattern that highlights the fracture with remarkable clarity. This ability to visualize hairline fractures is crucial, not only for diagnosing the problem but also for determining the appropriate course of treatment, as the presence of cracks can significantly influence the longevity and success of dental restorations. Furthermore, cross-polarized photography proves invaluable in detecting and monitoring other dental issues, such as wear patterns, enamel defects, and subtle changes in tissue texture. By providing a clearer and more detailed view of the oral cavity, This technique empowers dentists with the visual information they need to make accurate diagnoses, assess the severity of dental problems, and develop effective treatment plans. In essence, cross-polarized photography acts like a magnifying glass, revealing the hidden details that hold the key to understanding and addressing a wide range of dental issues. The impact of cross-polarized photography extends beyond the realm of diagnosis and treatment planning, significantly enhancing patient communication and fostering a stronger dentist-patient relationship. In dentistry, as in any medical field, effective communication is paramount and clear. Detailed visuals play a crucial role in bridging the gap between the dentist's expertise and the patient's understanding. Cross-polarized photography provides the visual tools needed to achieve this clarity, enabling dentists to effectively communicate their findings, explain treatment options, and empower patients to make informed decisions about their oral health. Traditionally, explaining complex dental issues to patients has often relied on verbal descriptions and rudimentary diagrams, which can sometimes be difficult for patients to grasp fully. Cross-polarized photography, with its ability to capture the intricacies of dental structures and highlight subtle details, provides a powerful visual aid that significantly improves patient understanding. By showing patients clear, high-resolution images of their teeth and oral tissues, dentists can effectively demonstrate the nature of the problem, illustrating the extent of decay, the presence of cracks, or other issues that might be difficult to describe verbally. Moreover, cross-polarized photography can be instrumental in explaining treatment options and demonstrating the potential outcomes of various procedures. For instance, when discussing restorative options, dentists can show patients images of similar cases treated with different materials or techniques, highlighting the aesthetic and functional differences. This visual approach allows patients to visualize the potential results of their treatment, enabling them to make informed decisions based on a clear understanding of the options available. The use of cross-polarized photography in patient communication fosters a sense of transparency and trust, empowering patients to actively participate in their own care. By seeing firsthand the issues affecting their oral health, patients develop a deeper understanding of the dentist's recommendations and are more likely to comply with the proposed treatment plan. Ultimately, this collaborative approach, facilitated by the power of visual communication, leads to improved patient satisfaction, better treatment outcomes, and a stronger dentist-patient partnership. Selecting the right polarizing filters is crucial for achieving optimal results in cross-polarized dental photography. While various brands and types of filters are available, certain characteristics are particularly important to consider. Firstly, the filter should be specifically designed for cross-polarization, ensuring that it effectively blocks unwanted reflections without introducing any color cast or distortion. Circular polarizers are generally preferred over linear polarizers, as they do not interfere with the camera's autofocus system. Secondly, the filter should be of high optical quality, minimizing any degradation of image sharpness or clarity. Look for filters that are multi-coated to reduce internal reflections and improve light transmission. The size of the filter should match the diameter of your camera lens and light source, ensuring a secure fit and preventing any light leaks. Several reputable brands offer polarizing filters suitable for cross-polarized dental photography. Hoya, B+W, and Tiffin are well regarded for their high-quality filters, known for their effectiveness in blocking reflections and preserving image clarity. When choosing a filter, it's essential to consider your budget and the specific requirements of your setup. Investing in a high-quality filter can significantly enhance the quality of your images and ensure consistent results over time. Remember that the polarizing filter on your light source is equally important as the filter on your camera lens. Ensure that both filters are of comparable quality and effectively block unwanted reflections. The combination of a high-quality camera lens filter and a light source filter is crucial for achieving the full benefits of cross-polarized photography, maximizing clarity, detail, and color accuracy in your dental images. While cross-polarized photography offers remarkable benefits, certain challenges can arise during the setup and shooting process. Understanding these challenges and knowing how to troubleshoot them can ensure consistent high-quality results. One common issue is incomplete polarization, where some reflections still persist in the image. This can occur due to several factors, including improper alignment of the polarizing filters, the use of low-quality filters, or the presence of strong ambient light interfering with the polarization. To address this, carefully check the alignment of your filters, ensuring they are perfectly perpendicular to each other. Experiment with rotating the filters slightly to find the optimal position for maximum reflection reduction. If using cheaper filters, consider upgrading to higher quality ones that offer better polarization efficiency. Minimize ambient light by darkening the room or using a light-blocking curtain around the shooting area. Another challenge is achieving consistent exposure across the image, especially when dealing with the highly reflective surfaces of teeth. This can lead to overexposed highlights or underexposed shadows, affecting the overall image quality. To overcome this, use a light source that provides even illumination, such as a ring light or a twin flash system. Adjust your camera settings, such as aperture, shutter speed, and ISO, to achieve a balanced exposure. Bracketing your shots, capturing multiple images at different exposure levels, can also be helpful, allowing you to choose the best exposed image during post-processing. Finally, ensure your camera and lens are clean and free of dust or smudges, as these can introduce artifacts in the final image, especially when working with high magnification. Regularly clean your equipment using appropriate cleaning solutions and tools. Pay attention to the focusing distance, ensuring your subject is in sharp focus. Use a tripod to minimize camera shake, especially when working with longer shutter speeds. By understanding these common challenges and applying these troubleshooting tips, you can master the art of cross-polarized dental photography, consistently capturing clear, detailed, and diagnostically rich images that elevate your dental practice. Cross-polarized photography has emerged as a transformative force in dentistry, offering a powerful tool for diagnosis, treatment planning, and patient communication. By harnessing the science of light polarization, this technique unveils hidden details, enhances clarity, and improves color accuracy, providing a unique perspective into the intricate world of teeth and oral tissues. The benefits are numerous, ranging from the detection of subtle dental issues to the empowerment of patients through clear visual communication. The adoption of cross-polarized photography signifies a paradigm shift in dental imaging, moving beyond the limitations of traditional techniques and embracing a future where clarity, detail, and accuracy reign supreme. As technology continues to advance and dentists increasingly recognize the value of this technique, cross-polarized photography is poised to become an indispensable tool in dental practice. It empowers dentists to provide better care, fosters stronger patient relationships, and ultimately contributes to a brighter future for the field of dentistry. The journey into the world of cross-polarized photography is an exciting one, filled with opportunities to enhance your skills, improve your diagnostic capabilities, and elevate the quality of care you provide to your patients. By embracing this technique and mastering its nuances, you embark on a path towards a more insightful, more effective, and more rewarding dental practice, where the power of light illuminates the path to optimal oral health.